Hi, I'm Dr. Chris. I'm the founder of MuscleCare, the all-natural topical pain, spasm, and inflammation reliever, and also our new massage cream designed specifically for massage envy massage therapists to differentiate them in the marketplace. The reason that I created MuscleCare was because I've been a chiropractic doctor for 35 years, and the biggest frustration is topical pain, and what can that patient or client of ours do when they leave our clinic to manage their pain in a safe and effective way when they go home or when we're not available. So I wanted to give you the same tool that I created to help my patients, and that's MuscleCare. So MuscleCare is designed to be different from the competition because up until now, everything that we used either didn't work or relied on the gate theory of pain, which is hot or really cold, to override the nervous system's pain receptors so that the person doesn't think about the pain momentarily. The problem is that the more we did our research, we realized that 92% of the topicals on the marketplace today had parabens and dyes and coloring agents and really not such good ingredients. Now, again, I'm a chiropractor, not a nutritionist, not a chemist. So I brought the chemist in and say, what is the negative impact of bad or adverse chemicals in topicals? And they said, well, listen, you should know this. The skin is the biggest organ in the human body. It's 1,600 pores or access points per square inch. So if things can move out like sweat or perspiration, things can also move in. And they said that parabens, for example, have been banned in Europe because they're bioaccumulative. They stay inside of you and they're seen in many types of cancers. So this is what led us to say, wow, we can't do that because inevitably that can't be good for the person short or long term, but it also may affect their pain. And I'll tell you why. We decided we wanted to be the only evidence-based topical pain product on the marketplace because everyone else didn't have any published, or the gold standard I say is published double-blind studies. So we started first of all by comparing the effectiveness of MuscleCare to all of the leading national professional and again, mass retail brands. So in 2012, a large double-blind study was conducted by a third party where MuscleCare outperformed all of the leading national brands and professional brands by a long shot. And what was interesting, the ones that had the most amount of parabens, dyes, and coloring agents actually had super high doses of menthol. So the person would feel cool for a minute, but thereafter, 7, 10, 15 minutes later, their pain tolerance was substantially less. So they were in more pain because those pain-sensitive nerve endings on the inside of the body were being aggravated by these chemicals. So it was really important for us to stay clean and all natural, which we've done up until now. The difference in us is also that we wanted to make sure we could say we were the safest. Now, the way you do that is you go to Mother Risk at Sick Children's Hospital, and through University of Toronto in 2015, they conducted an extensive year-long survey and study that was published on our product in pregnancy and nursing, and it is safe to use even when a woman's pregnant or nursing. So for us, that meant now we're the most effective, we're the safest, and later we then said, why can't we prove that natural can be as effective as drug cream? So Voltaren is a large drug topical that's taken over a lot of the marketplace, and it's got diclofenac in it. Diclofenac was banned in North America as an oral because of the risk of heart attack and stroke went up dramatically. So somehow, some way, because government regulations or authorities don't see topicals as being absorbable, they allowed diclofenac to come back into the game. So Voltaren is actually an extremely popular choice for the public because they believe that drug is stronger than natural. So we proved in a large performance lab at the University of Toronto's double-blind study that was published just this year in 2022 that MuscleCare is slightly better than Voltaren or diclofenac, a non-steroidal anti-inflammatory cream. That was really great. It's not statistically different, but again, even the author was to say equal in benefit to drug, natural, safe, why not use natural? So we're here today to say we wanted to make sure that we had the double-blind studies to support the claims that we made so you'd feel confident using MuscleCare, and it would change people's lives. We've had literally thousands of testimonials since 2010 where people have even been able to reduce their opioid consumption, some up to 60%, by combining MuscleCare roll-on or cream with their drug or medication routine through their physician's help. So again, it empowers the massage therapist to know that they've got something that's that strong that can really help, but it's all natural and it's safe. So different from everybody else, supported by double-blind claims, utilized for 12 years in the marketplace with no side effects. It's a safe alternative to anything that you've been using, and I think you'll notice a dramatic change in the benefits that your patients or clients will have using this in therapy and at home.